Greetings to the April 2014 No Roads to Health team. Really exciting with only 4 or 5 weeks to go. Induction's been an important part of our expeditions. We tried doing it by teleconference and that was good, but with a large amount of people it was really hard to coordinate everyone to be available at the same time. So we're going to try it via video and pop it on YouTube, and that way you can watch it at your leisure, you can watch it at multiple times. And if you've got any questions, please get in touch with me in relation to the trekking logistical stuff, and anything in relation to clinical or medical, get in touch with Joe Bergman in the first instance, and then Joe can farm those questions out to the most appropriate person. So here we go, No Roads to Health. You've obviously heard some of the statistics, and in Papua New Guinea we're making some small inroads with some of our partners, but the health system there is in rack and ruin. Currently the statistics tell us that there's one clinical healthcare worker to about 2,330 people. A small number of doctors, an even smaller number of specialists, and equipment. Well, when we were there last year, the one x-ray machine was unserviceable. So that's the situation we're dealing with. The stats will tell you that maternal mortality is one of the worst in the world, and the average age for a Papua New Guinea village person in particular is about 56.7 years is their lifespan. So malaria, HIV, TB, unbelievably rampant, especially in some of the rural areas again. 1 in 12 kids die before the age of 5, and that's twice as prevalent in some of the rural areas. 10,000 kids die a year, and infants are twice as likely to die before the age of 1 in the rural areas, so 85%. So that's unbelievable statistics. So in the past 35 years, the health system has steadily deteriorated, and outpatient inpatient services are now less accessible than they were. They were part of Australia in 1975, and since PNG got their independence, the country's gone to rack and ruin in relation to health and education services. So education is a key component, and obviously our mentoring and coaching program with the clinical healthcare workers is one of the main objectives for all our expeditions, and we will continue to do that. So we've got a number of partners there, and the critical ones are probably around the provincial health system. You've got the national government, provincial, and then the health government. So we've been working along with a lot of the provincial health officers. We've met the Prime Minister of PNG and shared our project with them. Kokoda Track Foundation continues to fund the community healthcare workers and do a lot of great work along the track. And people like AusAid and Coffee International, who work on behalf of AusAid, do some really good work, but in very trying conditions. So the No Roads to Health project team, which is now made up of myself, Lisa and Joe, we work on behalf of the No Roads Foundation, which is a charitable arm of No Roads Expeditions. And we've got a number of other clinical team leaders. Kristen, who will be trekking with us in April, very well travelled after doing Kokoda, Kilimanjaro, and trekking with us in November. Kirsty and Andrew Grasby, real name, comes on board as one of the other the expedition guides to help us through 2014. PNG Eye Care have been great too. That was something that dropped in our lap, and we were meant to team up with this group of people, and some of the results we're getting into some of the rural areas is really promising, and we're hopefully taking an ophthalmologist along with us. We'll meet them in Popondetta, and they will do some good work in some of the areas of Kokoda and Buna. So exciting times. We'll have a range of clinical objectives, and these are currently being reviewed. A couple have been modified due to our expedition, so they'll be circulated in the next 2 weeks. Now the itinerary. This is pretty much it as what I said to you with the visa information a couple of days ago. The idea is Cheryl and I will be in Papua New Guinea for a few days before the trekking group arrive. You'll walk through the doors after going through customs, and we'll be there waiting for you and taking you to your hotel, where we'll have dinner and a briefing. The next day we've got 2 clinics in Port Moresby, and at a clinic at 6 Mile, and then we go to the No Roads compound, and we'll be really working out of a shack. Okay, so that's where the Porters' families live in Port Moresby. We'll then have dinner that night, and then we get down to the business end by flying to Popondetta, where we'll meet Mary, and she'll have a couple of vehicles for us, and we'll head off to Boona. We'll work with Rodney during the day. That'll be a long day. Overnight in Boona. Next day we head down to Kokoda, so that's a fairly long drive. That's probably going to be about 4.5 hours, but through some really interesting areas of Papua New Guinea. And we'll get to Kokoda by lunchtime. It'll be an early start. We will visit the Kokoda Memorial, the museum there. The hospital will do some work in the hospital as they need us, and then prepare for the trekking component. Next day, which is day 5, we'll go Kokoda to New Isarava village. Now that's a hard trekking day. 5 o'clock up, 5:30 to 6 o'clock where we'll eat breakfast. We want to be out of there by 6:45, and we'll trek till about 3 o'clock in the afternoon. So that's 8 or 9 hours of hard trekking. We'll get there. If we've got enough left in the tank, we'll run a small clinic. Next day we go to the Isarava Memorial, and this will be a highlight of our trip. It's breathtaking, this place. So we'll pay our respects, have a service, and then head off to Aburari, where Terry works. Terry hopefully will meet us with Kokoda, so he'll be walking with us, and we'll be getting to know him. We'll go to Aburari into his aid post and work there for the day and overnight it there. Next day we hike out of the valley, meet up with our road transport, and head to Popondetta to the Comfort Inn, and have our last night and a bit of fellowship, and review the expedition, and overnight it. Next morning, plane from Popondetta to Port Moresby, hop onto our international flights, and home we go. That's day 8. Should be fun, should be fantastic. So that's pretty much the itinerary, as I said, and these are some photos here of what you can expect. The clinic at the compound, and a clinic done in a grass hut in the village. It's some basic work. Obviously, we'll make sure we've got lots of gloves, lots of hand wash, etc. And there'll be a lot of young women and children waiting to see us. A lot of our critical components about education, and if you get the chance to sit around and talk to the women, and I'll bring the porters in and we can talk to them and just explain to them about their bodies and what they can do to help themselves. So that's a really critical component, that making those relationships, especially on this trek. But as I said, it's hard trekking, so you've got 4 or 5 weeks work on your fitness, up till the week beforehand, and then ease off. Get some stuff in the tank and rest yourself, so you don't want to do an injury the week before you trek, and then we'll hit the track. Okay. We've got a trekkers agreement, which the expectation that all of us sign, including myself and Christian, and that's about our code of conduct and how we behave, about understanding that the strength of our team will be our diversities and our range of opinions, etc., and how we go about harnessing that for the good of the people. So have a look through that. There's no big surprises in there. The local population is very religious, Seventh-day Adventist primarily. Their Sabbath is the Saturday, so we'll be there at New Isarava village through the battlefield and through to Aburari, so we'll pay due respects to their Sabbath. But there is an element of sorcery, black magic, and Nelson or one of the boys will explain how that becomes part of their world and really affects some of their healthcare. Very, very interesting stuff. So, in relation to your preparation, from Joe and Lisa and the team, read up on malaria. You don't need to go heaps into this, but just a general read up on scabies and skin infections, TB, HIV, and just some other general health issues. We will be doing a lot of vital signs monitoring and head-to-toe health checks, as we're establishing some baseline data which we haven't got, and unfortunately spending a lot of time with the community healthcare workers talking about medication administration, because everyone who comes through the front door gets Panadol and antibiotics. Doesn't matter what you get Panadol antibiotics. So making sure we get the right message across there is really critical, or that you get the right message across to the community healthcare workers is critical. So if you need any help in fundraising, we've had some fantastic fundraisers over the last couple of days. The hullabaloo at Docklands was just a cracker of a night, and 200 fantastic people dressed to the hilt and really giving with their heart and souls. Megan from Arno, the osteopath, who's coming in March, Megan had a film night on Saturday night, and it was really successful. Some dues at the RSL. The Porters will be staying at my house tomorrow, and don't you hate it when your phone rings? And then we'll be going to the RSL, and the next two or 3 weeks are very steadily fundraising. So it's all going to be a full-on couple of weeks, but if you need any help in relation to flyers or press releases or anything like that, please give me a bell. Okay, now this is a fantastic story about a family in Cargie, and we spent some time with the women there and with the Porter Group last in November 2012, and what had happened was one of the ladies got an obstructive labour, and Steve went and got Jackson, who would work primarily with only 2 months beforehand, and we'd spend a lot of time with Jackson talking about this sort of stuff, or the midwives had. So Jackson, with confidence, got on the track radio, sought some advice, was able to get some information and get a plane flown in there the next day. So he kept the lady overnight, flown into Port Moresby, and beautiful baby Fiona was born the next day. So a real success story. If we do nothing else, this makes it all worthwhile. Any further information, there's a new Kokoda portal, and it's been on a couple of links I've sent you, Info Kokoda, and that's got everything in it. There's also that checklist, which is specifically for the No Roads to Health expeditions. So don't go by the checklist on this portal, because that's for normal 8-9 day expeditions. Use the one I sent you, okay, because it's a 4 or 5 day trek. So as I said, if you've got any further information or you need any questions answered, please contact me in the first instance regarding the trekking component, and Joe Bergman in relation to any medical questions. Take care of yourself. Enjoy the lead up. I think the build up is as good as the trek itself. It's very exciting, and I look forward to seeing you on April the 7th in Port Moresby.